in the CBSN Denver studio. The coronavirus pandemic is affecting everyone, and we know you have a lot of questions about routine health care you may need. Joining me now is Dr. Gregory Forlenza with the Barbara Davis Center for Childhood Diabetes, which is on the Anschutz Medical Campus in Aurora. And what are some of the impacts you have seen at the Barbara Davis Center since the outbreak of COVID-19?
Thank you for asking. So obviously with any population with chronic medical conditions, we're trying to limit their exposure to COVID-19. And so we've shut down all in-person visits and have moved to telemedicine for all of our routine follow-up care.
And doctor, are people with diabetes more at risk for coronavirus?
So that's a great question. The data out of the World Health Organization has listed diabetes as a strong risk factor for death with COVID-19. However, it's unclear what risk people with type 1 diabetes have versus people with type 2 diabetes. So at this time, we don't believe that people with well-controlled diabetes and people who don't have cardiovascular disease are at increased risk. However, people with poorly controlled diabetes, older persons with type 2 diabetes, and people with cardiovascular disease appear to be at much greater risk from COVID-19.
And what do people with diabetes, what should they be looking out for, and what should they be keeping in mind?
So that's a terrific question. We've been advising our patients about paying attention to just routine sick day management, that we expect that if someone with diabetes does develop COVID-19, that they'll have an increased level of inflammation, which will result in elevated blood sugars, requiring more frequent blood sugar testing and likely more frequent insulin administration.
And what are your biggest concerns when it comes to your patients and the food and medical supplies they may need?
So our biggest concern since the start of this has been interruption in supply chain. Obviously, people with chronic medical conditions, those conditions don't go away just because we have a new thing that we're worried about. And people with diabetes need to be able to get their insulin every day. And we've been worried about, with all the shutdowns, that might be interrupted. And so all the diabetes organizations that make insulin testing supplies and administration supplies and pumps and sensors have been putting out almost daily updates saying that they haven't had any interruptions in supply chain, that people are still able to get their insulin, still able to get their testing supplies. But for families that are now struggling financially, we have put some resources into place. So the Children's Diabetes Foundation, the philanthropic arm of our center, has been raising money to make sure that people with diabetes are still able to get insulin even if they can't afford it, and are still able to have access to food and nutrition, because taking care of diabetes is always a balance of both what insulin you're giving and what foods you're getting. And so we have developed resources just over the past couple of weeks to make sure that we can help support patients and their families with getting access to insulin and getting access to food so that they can continue to eat the way they need to eat and continue to get the insulin they need to get.
Well, doctor, that is a lot of helpful information. We certainly thank you for joining us today and giving us some of that insight. And you can find more information on the Barbara Davis Center on our website, cbsdenver.com. And remember, for the latest headlines on the coronavirus pandemic, you can join us here on CBS Denver at the top of every hour and half hour.